So today I was invited to a health tech summit here in New York City. It was sponsored by Cornell Tech. Thank you so much for inviting me. And I took some notes. I want to share them with you all before I go to bed tonight. Number one, people were asking, how do doctors get into tech? One guy went up and asked a very good question. He's like, what's the point of doctors in tech if a majority of the people who are working are engineers? And I was like, great question. When you speak with a lot of tech companies, they have such passion, but you need to be doing things that serve the patients and the providers who will be using that device or program or whatever. So then the next person, very spicy actually, Chris Klomp. If you don't know that name, that person is actually the director of CMS. He went up on stage and he was doing a great talk and he'd shared a lot of things. I took a bunch of notes. Every hour that a doctor spends clinical, they're spending 2 hours charting. That's not good. He said that AI right now is focusing on revenue optimization, which is when a patient comes in, how can AI help a doctor say you did these services, or maybe you should consider doing these services because then you can bill for more. And he's like, how disappointing that we're only thinking about that. And I was like, well, I understand what he's saying. He wants us to push past that. But that's an important part, that a doctor maybe was providing services this whole time and just didn't know that they were providing them, and now they can get paid for them. Prior auths, I talked about them several times here. I know a lot of you are very passionate about prior auths, myself included. And they talked about how it'll be great because then we can have, it almost seemed like the conversations, how can AI help us with the problems of healthcare rather than how can we solve the problems? And what I mean by that is they said regarding prior auths, how can AI find out why the prior auth was denied, look up the policy from the insurance company, submit the necessary paperwork and notes. And I was like, in the back, like as a child, I was like, but why do prior auths exist? Fix the broken thing that health insurance companies are practicing without a medical license. Maybe that's just me. I'm a little spicy, right? Really spicy? Very spicy. He made up a really important point to talk about interoperability. He's like, why is a patient's data locked behind Epic, locked behind Cerner? Why is a patient not in charge of their data where they can carry it with them everywhere they go? And then he also mentioned the call. This got him like a round of applause from everyone because he said, if you're in this room and you chose healthcare, you can make money anywhere else. If you're choosing healthcare, you have a social contract with the people of this world to say, I will serve you. If you're solving your own problem, which is you want to make money, you're not worth anyone's time, solve the patient's problems. You have to talk to them. A lot of stuff about mental health. Loneliness is equivalent to 20 cigarettes a day in terms of how it increases your mortality risk. Can AI help solve those things? And I had so many questions about peds and how, again, should technology, this is a question for you, be something that helps us? Like, what's the point of it? I understand technology as it's supposed to help bring us together. Instead of while being lonely, you use technology to FaceTime a friend, it's you use technology in place of a friend. As a doctor, you're basically just trying to find patterns in your patients, which is very cool because they were talking about mental health screening and how when you bring a patient in every 2 months, when you have them do like a PHQ-9, a questionnaire about their depression, their anxiety, you collect that data, you see how it did last time, and then you bring them back in a few months to just keep tracking how it's doing. We understand enough about disease and illness, but maybe there's more that we could learn because it's all about the patterns that some doctors somewhere came up and called these syndromes and diseases, and it's just based on their own personal experience. But what if everyone in the world could share their experiences and we get global patterns? A lot. Good night.